I'd like to welcome Dr. Lina Vargas, who's the president and owner of Lumina Vein and Aesthetic Institute down in Windermere, Florida. Welcome.
Thank you. It's such an honor to be part of this podcast today and be able to spend some time with you talking about this important topic.
So we're going to be focusing on the upcoming webinar from EmpowerHer2, focused on cosmetic venous procedures. So can you tell us a little bit about this upcoming webinar? It's coming up on
Yeah,
January
absolutely.
18th.
Yeah, I'm very excited about it. I can't wait. I think it's such an important topic nowadays. I think that more and more there's not only vein practitioners, but vascular surgeons in general, just trying to be able to offer more of these aesthetic treatments to their patients because the demand is in growth for sure. And some providers may be wanting to try to, just really focus, be able to offer more of those comprehensive treatments. Maybe they're looking for a change in their type of practice, something that allows them a little bit of a better quality of life, for example, just being away a little bit more from the hospital. We see that all the time. And so it's nice to be able to share our perspective and our experience as far as being able to offer the right treatments, get the right results that our patients are looking for, and sharing our perspectives with our guest speakers who for this webinar are from Brazil. Just being able to share different opinions, different ways of doing things around the world, finding common ground and maybe differences, learning from each other. So I think this is a it's going to be a very interesting webinar that I think is going to benefit not only maybe trainees who may be thinking about this as they go into their own practices, but also vascular surgeons or practitioners who are already doing it and maybe are looking to change their scope of their practice or just want to be able to offer better treatment. So it's going to be beneficial for a lot of us out there. So very excited about it.
So you mentioned briefly that there's should be specific training. Um, what type of training do you need to be doing these effectively, appropriately, and setting expectations for patients also?
Yeah, I think it's, I personally trained at Cleveland Clinic, and I can tell you that our focus was not on sclerotherapy or how to treat. Obviously we did vein treatments, but our focus was not necessarily the aesthetic side of it. And so a lot of the training comes just from experience, from participating, in conferences and webinars like this one. But also for those who are really wanting to do it, there's preceptorships that are offered, throughout the country, and we can get you connected with them. But it's important to just, understand that there is a thought process. We need to understand vein disease. We need to understand that this is not just a cosmetic thing, and that, for example, in cases where a patient may have some symptoms that addressing vein disease from a medical standpoint is essential. Otherwise, the treatment is going to be insufficient. Being able to understand that, which is where when other types of practitioners, let's say dermatologists, or nowadays there's so many nurse practitioners and physician assistants opening up their own aesthetic practices. Maybe they just dive into sclerotherapy without even having an understanding of what vein disease is, or the importance of treating it from a medical standpoint if there is that internal background that's leading to those capillaries from forming from venous hypertension, for example. So just from a understanding functionally why they happen in a specific patient, how to address them, be able to achieve those ideal results. It comes from experience. It comes from learning from physicians and practitioners who've been doing it for a while and attending courses throughout the year, whether in person or virtually. It's just very important because at the end of the day, we need to meet our patients' expectations. And we're doing this for them at the end of the day. And we need to be able to offer a treatment that's going to be satisfactory, that's going to be safe. And so what we want to share is there's different ways of doing it, but just how to do it in a safe way, how to address complications, and, learn from each other.
So can you give us a few of the details of the speakers, their topics?
Yeah.
Because it's an international faculty and we can have a lot to learn from different countries and different experiences.
For sure. And I am excited to have invited Dr. Nara Medeiros and Dr. Solange Evangelista. They're both from Brazil, which I think is really important. I think Brazil in general, Latin America is one, territory of countries that really, really focus on aesthetics. And so they have ample experience in different ways of treating spider veins and telangiectasias. Dr. Solange has a very interesting practice where she uses foam for 100% of her treatments, both from a medical and aesthetic standpoint. So she has a vast experience with different types of foam and concentrations. And unfortunately, in the US, we don't have access to some of the agitators that are available in other countries. And so she has mastered this technique of being able to get really, really good foam by using agitators and using different concentrations for different types and sizes of veins, which is very important. It's not, we need to be able to learn just the different concentrations that are required for the different types of veins. And she has mastered these really, really well. So I'm very excited to learn from her and get her perspective on her essentially 100% foam practice. And then Dr. Madarius, she is going to talk to us about plaques. So combination of sclerotherapy with cryo laser, which I think is very important nowadays. We have access with technology and advancements. We have access to different kinds of lasers that are safer, more effective, and more precise for treating veins and lesions in legs. I personally have a lot of experience with lasers, and I can tell you that it's important to really master the physics of lasers and understanding that the different wavelengths, I mean, there's not just one that's going to be effective. And from doing treatments of vascular lesions on the face with certain types of lasers, those are not the same or are going to be as effective for legs. Leg veins are a totally different animal. They are more venous, they're larger, they're deeper, they behave differently. And so really understanding the type of laser that is ideal to treat lesions in the legs or spider veins, telangiectasias in lower extremities is very important. And how the combination really works. I think that sclerotherapy is the gold standard, but having the ability to use and master a laser to be able to get even better results, that is just very important. And so I'm very excited to get those two perspectives and just learn all the tips and tricks from them as they've mastered these two different techniques.
I'm also interested in hearing about the tips and tricks that you have because of your US experience in terms of bridging the
Mm-hmm.
experiences between Brazil, Latin America, and the US. So
Right.
I think there's going to be a very interesting interplay. I'm really looking forward to this webinar. Again, it's on January 18th at 10 a.m. Eastern Time. Thank you so much.
Oh, thank you so much. And I hope to see so many of you in the webinar. And again, just having a broad spectrum of, practitioners who are just starting out and wanting to learn, and those who are super established but just want to get a different perspective that's refreshing, that can, maybe give them a different perspective. So very, very excited about it.
Thank you.
You're welcome.